All right, it's Dr. Nicholas Jones, Dr. Nip and Tuck, and this is part 3. And we're here with Dr. Jacqueline Turner, who is a colorectal surgeon here in Atlanta, Georgia. Board certified, by the way. And, not only is Dr. Turner a colorectal surgeon, she's a personal friend of mine, and I think she gives great relationship advice. Like we've had lots of discussions about relationships, and that I mean she's given me some really good advice. I think it's like as a man, it's good to have a female friend that you have in your corner, and the relationship's completely platonic, because I can speak for myself. Like most women that I'm friends with, we've had some sort of romantic encounter. Like I think for a lot of men. I mean, actually, I can't speak for any other man, but I think a lot of times when men have female friends, they've had they've had some sort of romantic relationship.
Most of the time.
Yeah.
Yeah.
Yeah. So, I was recently on. I love Instagram. Like I'm addicted to it because I like to look at pictures. I'm a visual person.
And I'm anti-Instagram.
And so they recently, this guy posed this question, and it was to men, and it was basically, the question was, why are there so many single women in Atlanta? And he asked for comments, and my personal thought, I mean, I think it's multifactorial, obviously, but one reason is that, for example, like there's women like yourself who have professional jobs. Like you've gone, you've got educated, post-bac programs, like you have a postdoctoral degree, blah 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 blah, and like you've excelled. And I think when you look at college campuses and institutions of higher learning, there's just not that many men going to school these days.
Yeah.
And then not only that, so you go on, you finish school, you got this degree, and now you're a doctor, and they probably, I mean, they don't have a lot of male doctors. Not only do they have, not, I'm talking about black doctors. So there's not a lot of black professional men, and so you don't have a lot of options. So the black men who are professionals, they have like all these women available to them. And so once they select one and they like find, a suitable partner, then that's it. Then the other women, they're just stuck in this little small pool of men, and they just don't have a lot of options. And a lot of y'all feel like it's settling if you go ahead and, marry the guy who works at Walmart as the mechanic. I mean, I don't feel like you have to settle, but I mean, is that accurate? Am I speaking any truth at all?
You're speaking truth. I mean, so we're a lot of women are career men too, but I mean, as you mentioned, there are more black female doctors than there are black male doctors. We've kind of discussed that on many levels, from undergrad to
even on undergraduate campuses.
Yeah.
It's mostly females, and then the guys, half of them like men. So it's not a lot of options.
It's difficult, right?
So what do you do?
I think as a professional woman, you do need to be open. And no, it's not settling, but the perfect person doesn't necessarily have to be another doctor. It does not necessarily have to be somebody with a professional degree that you have. You need to look at other things. Does he make you happy? Does he attend to your needs? Is he supportive? Does he still do the things that a man needs to do? So
what do men need to do?
He still needs to, provide for his family. He might not be the breadwinner, but he still needs.
But how can he provide for his family if he's not the breadwinner?
He can provide.
If you're the colorectal surgeon and you have a 6-figure salary, and he's
So y'all need to come to an understanding and see if it's important for you not to be the breadwinner, then you need to find somebody that makes more than you. But as you go along in life, money is not the only thing that's going to make you happy. When you start getting my age, you're going to realize that there are other things that make you happy besides who makes more money. To me, that's trivial. But can he make you happy? That's going to be, you're going to start shifting. So even if you asked me this question 10 years ago, what I wanted, like, he has to make as much money as me, and he has to have this degree, and he has to be, look this way. And it shifted because I had those things and they didn't make me happy. So now I want him to be attentive to my needs, he still needs to work, don't get me wrong, but he needs to be able to understand the way he can make me happy with his salary. So he needs to figure that out. And it can be done.
Right. So can I ask you a personal question?
Sure.
Are you in a relationship right now?
Oh, I don't know.
You don't know. So
depends on when this is gonna be posted. Probably not, I would say.
So how about how can I say this?
Just say it.
So I'm sure you wanted to you would with everything going, I mean, your career is pretty settled. Like you're where you want to be, and as far as relationship wise, I'm assuming that you thought you'd be married by now.
Right.
So what do you think? Why do you think that's not the case?
My first half of my adult life that I've lived so far, I spent it in a book. Hindsight, I probably would have spent more time on my relationships. I'm not gonna lie.
But how are you going to advance in or pursue your career and make sure that your relationship's
You gotta make it
healthy?
happen because it's never gonna get better.
So it is possible.
It's possible.
Mm-hmm.
It's never gonna get easier because it's always gonna be some other excuse to come up. Now I'm going up for this promotion, so I gotta do this research.
Right.
It's always gonna be something.
Right. So, I mean, I've known you for a while, and I've known a little bit about your relationships. And I personally, I mean, this is just my opinion.
Go ahead.
I think you hung on to a relationship that wasn't really going anywhere for a really long time. Now, that's just my opinion. But your perspective, like, how do you know, as a woman, like, if you're in a relationship with someone, when do you just decide, like, you know what, this ain't really going nowhere? Like if it's your end goal to be married and you want kids,
right,
and you're with a man and you love this man, and let's say he already has kids. If he already has kids, it kind of puts you at a disadvantage because, he's like checked that box off. And he's in no rush to like get married, or he's not pressed.
right.
Like women feel like they have this clock. I mean, you do have a clock because your ovaries only gonna produce X amount of eggs, and you don't want to be like.
That brings up 2 points. So any woman that's in the medical field and you're approaching the age of 30, freeze your eggs.
30?
Yeah, you want to freeze your eggs before 35.
Okay.
You can freeze them up to age 40, but you're going to have better quality eggs and a better chance of a harvest before 30.
So how long is too long? Like when should you just cut it off? When should you just say like, just, you know what?
That's something every individual couple is going to have to make. That's something every individual is going to have to make for themselves.
But what are some signs that it's not like?
For me, I felt like I was doing more giving. Mm-hmm. Then it should be a two-way street. It should be some give and take. Even through the hard times, you're going to have to make some sacrifices, and somebody's going to be giving more than the other, but it should never be a one-way street. And when I saw that it was a one-way street, and I hate to abandon somebody in the middle of hard times, trust me, that's not what I wanted to do because I really care for this person, and I still, if that person called me up right now, I would still come to his side, because ultimately he's still one of my best friends.
Mm.
But even with the friendship, it can't. It's a give and take. It's a two-way street. When you find that it's one way, then it's time to let go.
But I can imagine like it's really hard to let go.
It is. That's why I said it depends on when this is.
So how were you able to let go?
I do things for myself.
Like why did you just all of a sudden say it was enough? Like I'm sure there's been times before where things weren't going so well, or you just felt like you were giving too much. Like why now? Like why not just wait?
Well, I've been working with I'm gonna be personally for real. I've been working with a counselor. So when I had some realizations about myself and about the situation, I had more insight. And it was when you have more insight on your situation, that's when you're like, it's time to let it go.
And I think that's good. Like a lot of times, I think we try to deal with things on our own, or we think that we can fix it ourselves, especially as physicians or professionals. Like you're smart, you're a bright, very bright person, and you feel like, oh, you know what, I can take care of this myself. But sometimes you can't. Like you recognize you're struggling with something, and then you have to step outside of the box, look at the situation, and say, you know what, I keep doing the same thing over and over again, and clearly I can't fix it. Right. So I think it's great to seek counsel. Yeah. And I personally, I've seen a psychiatrist before. Did it help me? I don't know. Maybe I didn't go to enough sessions, but I think recognizing that I can't do it all on my own is a step forward. Yep. Yeah. Well, thank you, Jacqueline.
No problem.
Thanks, Dr. Turner. That was
Right.
Yeah. So that's it. You know what? We're gonna stop here. We're gonna take a break. I want to thank Dr. Turner again for sharing her experience and about her relationships. And I'm getting a text message. We have choir rehearsal next week, and I think a closing point would be is if you're not happy in your relationship, or if you feel like if it's one-sided, if it's heavily what am I trying to say, Jacqueline?
If it's not a mutual a symbiotic relationship.
If it's not a symbiotic relationship,
you might need to reconsider.
You need to reconsider, and always keep the lines of communication open. If you're not communicating with your partner, then the relationship is more than likely to fail. So keep communicating, and if you're not getting what you want and changes aren't being made, then you should just leave the relationship. If it's a person that you're meant to be with, y'all will figure it out, even if it means y'all need to taking a break. So that's how I feel, and thank you, Dr. Turner. Tune into the YouTube channel. If you have any questions, let me know. If you have any comments, if you liked the discussion, you want to hear more, please let me know. Thank you. Have a good night. Go Saints. Go Tigers.